Today's report outlines a bold framework to improve children's health through 128 targeted directives and strategies. This report is the result of a thorough and robust policy process that relied heavily on the input and expertise of families, farmers, doctors, industry leaders, and innovators. This strategy aims to create systemic change to protect and promote children's health through 4 key pillars. 1, driving innovation through research. 2, policies to realign incentives and systems. 3, increase public awareness and knowledge. And 4th, private sector collaboration.
There's never been a president in my lifetime that is more willing to challenge businesses when they overreach. It was more fearless about challenging entrenched interests in our society. And so many times I've had discussions with him about a certain injury or illness, and he'll say how unpopular it will be if we talk about the solutions, which are going to hurt certain businesses. And he said, I don't care. He says again and again, I don't care. This is children. We need to save the children. A lot of these 128 recommendations are things that I've been dreaming about my whole life. I've been working for in congressional campaigns and presidential campaigns for other candidates. And they get into office and they say, well, we just can't do it. A lot of these things are things that I never thought about.
But there are real scientific issues that need to be addressed. Why are autism rates going up so quickly? What can we do about it? What's the answer for type 1 diabetes for kids? What are the long-term effects of the rising use of antidepressants in children? The problem of ADHD. You can go on and on and on and on. What you have is a picture of real questions that need to be answered with excellent science.
At the Trump EPA, we are accelerating innovative and vetted crop protection products to enhance an American system of agriculture that is already the best in the world. At the same time, EPA is aggressively confronting and addressing the threat of banned pesticides imported or smuggled into the United States from China and elsewhere. These are highly toxic substances that can be fatal to humans and animals and damage our environment. It is a top priority in line with the Make America Healthy Commission to protect Americans from this threat.
The EPA is arguably the most rigorous, the most data-backed, the most scientifically deep review process in the world. And to approve any product that is used by our farmers, it will have gone through years upon years upon years of research.
Tools that are meant to fight disease, such as vaccines, antibiotics, and therapeutics, can save lives, can also trigger adverse events in some patients. And that truth must no longer be denied or distorted. We're bringing transparency and research to this critical connection.
We had lots of guns when we were kids. We had comparably the same number of guns. Nobody was doing that. We had gun clubs at my school. Kids brought guns to school and were encouraged to do so. And nobody was walking into schools and shooting people. And this is not happening in other countries. There are many, many things that happened in the 1990s that could explain these. One is the dependence on psychiatric drugs, which is, in our country, is unlike any other country in the world. It could be, there could be connections with video games, with social media, or a number of things, and we are looking at that at NIH. So we are doing studies now. We're initiating studies to look at the correlation and the connection, potential connection, between over-medicating our kids and this violence. The Advisory Committee of Immunization Practices is reviewing the science on every vaccine. They're reviewing the reports in the vaccine adverse event reporting system and in the scientific literature. And they will be reviewing vaccine recommendations. So, that is something, there's a panel of experts. It's going to meet again, I think, on September 18th, and they're going to do a real gold standard scientific review.